And last, but certainly not least, I'd like to introduce Dr. Jim Fabizak, who will be the moderator for this session. Dr. Fabizak attended Syracuse University for his bachelor's and Cornell University for his master's prior to receiving his PhD in pharmacology at the Pennsylvania State University School of Medicine. He did postdoctoral training at the University of Vermont and was the recipient of a Parker B. Francis Fellowship in Pulmonary Biology and Respiratory Medicine. He is currently Associate Professor of Environmental and Occupational Health and Director of the Center for Healthy Environments and Communities at the University of Pittsburgh. Dr. Fabizak is studying public and community health risks associated with air pollution, oil and gas development, and marine oil spills. Thank you, Dr. Fabizak.
Hey, Jessa, thank you for that introduction. I'm assuming everyone can hear me fine. First off, I want to thank all of the presenters who gave such informative and lovely presentations. It's interesting to see the field of EJ scholarship, which was sort of initially, as I began to sort of look at it, kind of restricted to the area of social sciences and political science, but we begin to see more and more literature now appear in the sort of environmental health science journals that we look at. And granted, certainly based on the sequence of current events that's happened over the last couple of months, racial justice, economic justice, all this has risen quite high on our radars. So what I was hoping to do is to just kind of have the panel participate in some discussions. I'll sort of throw out some very general questions. So they might not be necessarily specific to the sort of work that you did, but to sort of get you to sort of speak to some of the issues that go above and beyond your specific work. I want to kind of acknowledge Laura, especially because she kind of pointed out two things in her early framing talk that I wanted to sort of come back to. And one was this sort of issue of the urban and rural divide. And the second has to do with the sort of community engagement and multi-stakeholder model. So let me just sort of first, when I sort of came to the field of environmental justice, I thought most of that work was primarily being done in either urban settings or around major, large industrial point sources of pollution. And when we deal with oil and gas development, we tend to be entering into a different environment, which is primarily rural and has some challenges associated with that. So I was hoping that maybe each of you could sort of comment on what were the sort of specific limitations and challenges and perhaps even opportunities when working primarily in rural environments when most of this sort of literature has so far emerged from other places. And if you want me to pick someone to go first, maybe I'll just go to Laura.
Sure. Thanks for the question. I think, these are maybe not very original thoughts, but one of the challenges is always, at least for those of us who are trying to do epidemiological work or exposure assessment work, the remoteness of some of these areas, the lack of regulatory, like air monitoring data, for example. In our work on flaring, there's only 2 monitors in the whole Eagle Ford Shale area. So there's just a real lack of information, which is why we kind of had to turn to the satellite data source. And there's also limitations around what epidemiologists can do in terms of linking exposures related to oil and gas with health outcomes when the number of people is small, and that's just a limitation of our, current statistical methods to infer relationships in small sample size situations. So all of those, I think, make it particularly challenging to study the health impacts of oil and gas development and the community impacts in rural settings. I guess on the other end, at least for, I could speak to the flaring work. One of the things that makes it more feasible in a rural setting is that the satellite observations pick up industrial or heat sources. So they will also pick up things like industrial facilities, refineries, power plants, things that are burning fossil fuels. So it'll pick up things in urban areas that aren't flares. So because our study areas are largely rural, we have a lot more confidence than we would in a more urban setting that what we're seeing in the satellite data is actually flaring and not something else.
Right. You would see those big hotspots around some of the big cities like Houston and Dallas when you were showing that. So, yeah, you're
Exactly.
right. Okay, I would see that. Okay, how about Cassandra? Any thoughts?
Yeah, so this is actually an issue that kind of permeates a lot of the work that I do. So I mentioned that my work was conducted under the umbrella of the Yale Water Study, which is led by Dr. Nicole Diesel. And so in that study, we actually go out to residents' homes and sample their water in Pennsylvania, Ohio, and West Virginia. And so Dr. Cushing mentioned that, things like air monitors are very, very sparse in these rural areas, which means that sometimes we don't have environmental measurements to kind of assess exposure out there. So we turn to these epimetrics, these spatial metrics, how close what's the residential proximity to the well? And one thing I learned from personal experience is that a lot of times the address that, a rural home is assigned may lead you somewhere very, very far from the actual home. So that leads me to wonder, when we are using these spatial metrics to assess residential proximity to oil and gas wells, there may be a pretty high degree of inaccuracy there, which can lead to a lot of exposure misassignment. Beyond this, returning to kind of the idea of environmental justice in urban settings versus rural settings, one limitation I encountered in my study was, there are fairly sophisticated metrics of assessing racial segregation and income differences and inequalities within areas, but those metrics were primarily designed to function in urban settings. And so they don't function nearly as well in these kind of rural communities. So the metrics that I ended up using to represent income and race and ethnicity were fairly simple at just kind of county level census information, which was the smallest resolution I was able to kind of harmonize across all of my data sources. So I think the main thing that I want to bring up as well. So I saw a question go by, I think, during my presentation that I want to just address because I think it's related to this and also really important. And it was asking if I thought that all of the racial groups that I've been together in that percent AAN category, which represented a lot of different minority racial groups, if I thought that those groups experienced structural racism similarly in this scenario. And the answer is no. I really probably the experiences across the different groups can be quite different. And even then, if you're summing experiences at the group level, you're never going to capture the breadth of everybody's individual experiences. And it was an unfortunate fault in not necessarily a fault, but an unfortunate facet of the modeling that we tend to use in epidemiology that we need enough statistical power to investigate individual groups. And so I had to kind of sum several groups together because the models were simply too unstable not to do so. And I think that's really unfortunate that a lot of times we can't investigate individual groups sufficiently.
Sure. Yeah. I mean, in some ways, in an urban environment, you have the concept of a neighborhood. And in the same way, around a major point source, a neighborhood can be identified. It's a little hard to look at a county in rural Pennsylvania and call it a neighborhood. I mean, it's made up of many, many different spatially and demographically related components. But okay, great. How about Catherine? Any thoughts?
Yeah, so I guess I have a couple of thoughts that are maybe tangentially related to your question. One thing that I think is really important that I think has come up a couple of times in this conference is, and I guess I'll preface this by saying that I am a social scientist, and so I think that I think that this interplay between looking at using the tools both of the social sciences and epidemiology and other health sciences together is really important. I also think that something that we really need to look at here, and this really speaks to what Cassie was just saying, right? You need enough observations, you need enough statistical power to be able to run these models. And the fact that we don't have that isn't an accident, right? This is people have used the term manufactured uncertainty, right? So in some ways we need more of this social science and political science lens onto data availability or the lack thereof, right? So understanding why we have so little data to work with on the health impacts, and again that's not an accident, that is a strategy. So I guess I would just to say that that's I think a really important part of this story.
Okay, we lost you there for a minute on your last, at least I did.
Okay.
Your last 30 seconds or so of what you were saying. Did you want to try to repeat that, or?
Did others hear me?
I think it might have just been you, Jim.
Okay, sorry about that then. Okay, that's fine. How about Rebecca?
Sure. Obviously, my experience is a little different than those who are doing research out in the field. I will say that having folks who live in rural communities makes it challenging for our agents and investigators to meet with those folks at times. But I think on a more personal level, it can create even more of a sense of isolation for some of these folks that are experiencing these impacts because they live in an area that is isolated, and oftentimes their perspective may not be the perspective of their neighbor who maybe has a lease with a particular operator and thinks that everything's great. And I have certainly seen where the small communities can really be torn apart by this industry, where operators will play one neighbor against another. So I think that's really the impact that I've experienced with dealing with the much more rural community.
Okay, no, that makes sense. Okay. Then let me at least sort of change pace here a little bit and talk a little bit about what might be sort of policy and solution-oriented kinds of approaches to some of the things that we've been talking about. And so we've heard a lot, and Laura, again, mentioned it sort of in her beginning statement about a sort of multi-stakeholder approach to involving all of the sort of relevant stakeholders in a decision-making process early on that sort of democratizes all of the decision-making, gets everybody at the table, sharing their concerns, et cetera. And so I could see that as somewhat feasible, especially from a sort of utopian kind of situation, in that everyone arrives at the table at the very beginning of the process before these decisions and the beginning of the activity has begun. Example, we discover gas on the moon, and we're going to colonize the moon, and all of the people going up there meet ahead of time to decide how they are going to parse out and do this in a fair, equitable manner. However, now we have a situation where the process has proceeded considerably in the absence of that. How do we bring that multi-stakeholder model to the table and repair all of that trust that has already been damaged because of everything that's gone on and incorporate it? Or can't we? Do we just sort of say, well, we got to leave things the way they are, and moving forward, we'll adopt this new situation? So just your kind of broad thoughts on that. I know that's kind of a big one, but it would be the kind of thing that, if instituted early on, would have prevented Rebecca from having to do what it is that she did.
I'll just a couple of thoughts, and partly in response to a couple of the questions that were in the chat too, with respect to what the COGCC is trying to do now, right? So operating like you said, Jim, from a place where we are where we are, but how do we do things better going forward? I don't see in that rulemaking any attempt to retroactively start dismantling wells necessarily. But for these questions about how is new development going to proceed going forward, and I think what I've seen there is that, again, there was a lot of discussion and attention to this question of defining who are disproportionately impacted communities. How are we going to identify those communities? And I think the much trickier part is sort of codifying what the participatory justice part of that looks like. So how can we write rules that guarantee that industry can't just check boxes, but they actually have to meaningfully engage with communities, understand their concerns, address them, and potentially, if they don't, that permit will be denied. And so I think a lot of the partly we just don't have I don't know that we have a lot of that is maybe harder to write down rules for, and it's really going to be on the implementation side. And I guess I would just say again, one more hopeful note is that I think that is something that the current director recognizes. So she and I had a conversation where she was asking for guidelines for community engagement and best practices in that area. So I think there is at least a recognition that that this really is going to come into implementation, enforcement, and all of that. And I think there's a desire on the part of the new commission to move in that direction, but it remains to be seen how that plays out.
Rebecca, do you see any role for bringing multiple people to the table besides the courtroom, I guess?
Right. Well, I think certainly everybody benefits from having multiple voices sitting around a table. And I truly believe that our Commonwealth would be in a different place if that had happened before this industry had come to town. Certainly, regs and policies should not be created in a vacuum by people who don't understand the experiences of those living with this in their backyard. How that happens, I'm a prosecutor at heart, and I've spent a lot more time in my recent past speaking about these issues since the grand jury report came out. And I think that, I'm happy to talk to whoever I can talk to help educate and move the ball forward in regards to creating better regs and better policy moving forward. And I think that there are certainly others out there that are willing to do the same. And there are certainly good legislators across the street here in Harrisburg that are willing to listen and to champion some of these issues. I think that, you know, it requires tenacity and the willingness to keep going in spite of getting doors shut in your face, because there's certainly others who have no interest in having those kinds of conversations. But I do think that everybody, all citizens, would be better served if we can, you know, have those kind of roundtable discussions where we can all learn from one another, and those who are making the regulatory and the policy decisions are being as well informed as they can before those decisions are actually made.
Okay, thanks. Laura, any thoughts?
I guess I would just say, you know, community organizing has always been the sort of driving force for addressing environmental justice concerns. And I think that's really where the power lies in terms of bringing about regulatory change because of the unequal power dynamics between these different stakeholders. It's only when communities are able to organize together that they can exert, you know, some influence or more influence in the process. And I do think it's challenging. You know, I was just watching some of the comments in the chat, and Dr. Diesel brought this up earlier, how, you know, the science is always lagging or behind what's actually happening on the ground. And so sometimes these decisions are being made before we have many studies to even know what the potential impacts would be. So, you know, the type of process you're describing, I think, would require a radical re-envisioning of how we approach and permit things like oil and gas development, a shift to a more precautionary principle type approach where alternatives are considered, and, you know, the burden is really on the individuals proposing the activity to show that it's safe rather than on communities to show that it's harmful. So I would just offer those kind of big picture thoughts.
You mentioned that community organization advocacy kind of approach. But, you know, history has always sort of indicated that those have been reactive to something that's already occurred, rather than an attempt to try to incorporate that before the damage has been done in some way. But I just trying to avoid repeating all of the lessons that we keep having to learn as we go along. I just see we've got a couple of more minutes left, so I'm going to basically turn it over to the moderator that I hope has, I don't know, I guess that's Jessa. Have you been able to sort of glean some questions from the audience that might be relevant to ask?
Actually, it's Debbie.
Yep, Debbie's been collecting lots of questions throughout this session.
I thought it was Jessa who was doing the introductions for each session. Sorry.
Yes. So hang on one second here. We do have quite a few questions. So let me start. I'll just start going through and try to ask one per person, and then we can circle around because we are running really low on time. This is for Dr. Cushing. With environmental justice's bond to capitalism, it is very encouraging to know that the World Economic Forum recognized the need to revisit capitalism. Are you in communication with the powers of the WEF, particularly in the need for sustainability, to proceed any conversation and planning regarding the economy?
I am not in communication with that group, but I appreciate the comment. And I think in general, you know, there's a lot of scholarship on the connections between environmental justice and racial capitalism. So I think it's an excellent question and point to bring up.
Okay. This is for Cassandra Clark. This is a little bit long, but Regarding environmental justice, FERC issued a combo permit for next decade's repaired Rio Grande LNG and Rio Bravo pipeline project by discounting the local high rates of minority status and low-income status based on the alternatives analysis that looked at a couple of alternative sites on the Texas coast and the no project alternative. The no project alternative was discarded based on supposed public interest for the exporting of LNG. Since all three sites involved equally disadvantaged populations, FERC asserted that approving the next decade preferred site did not constitute a violation of environmental justice principles. What are some ways to contest FERC's assertion?
Well, so I'm not a social scientist or a political scientist. I'm very new to the field of environmental justice. And I also, unfortunately, don't do any work in Texas. So I'm not positive that I'm the best person for this question. But perhaps maybe that speaks a little bit to something that Nicole, I think, asked in the chat, which is how can scientists and epidemiologists in particular make their research more useful for lawmakers or regulators and things like that. Because, if I'm understanding, so they were attesting that all of the possible sites were, equally vulnerable. But, maybe if there were some research to support, support any of the arguments that the vulnerable communities were trying to make to keep away whatever issue, maybe that would have had a little bit more credence. Yeah, I'm not sure that question was for me.
Oh, okay. I'm sorry. It was asked while you were speaking. So let me just give you the second question, which was definitely, and you're going to have to think back. It was towards the end of your slides, but in this context, do you expect structural racism to similarly affect the racialized you bend together? Is that okay?
Yeah, I'm really glad you brought that up. So that was, I mentioned it really briefly when I was talking a couple of minutes ago, but that is like, Dr. Cushing has mentioned, that's kind of an artifact of the epidemiologic methods that we used and the statistical modeling methods that we use. So the rural population in Pennsylvania was on average 95% white and 5% or less of any number of minority racial groups. So that made it really difficult to isolate individual effects to individual racial groups. And I don't think that, I don't think that, Black citizens are having the same experience as Indigenous or Native citizens. I think it's just, this was a very kind of large scale, big picture study that was intended to maybe guide the way for future, more detailed work. And so I think that's definitely an area that can be improved on, is the ability to kind of more closely examine these individual groups.
Okay, thank you. Chief Deputy Franz, we have a question here, two that are pretty much the same. Can you comment on the size of the sentenced fines for the investigations? They're quite low and they wouldn't seem to serve as a deterrent, and the penalties imposed on the companies seemed minor to the impact they caused. Is that because of company legal coverage?
Sure, that's a great question. Ultimately, the fines that were imposed were based on the statute itself. So there's a statute within both the Solid Waste Management Act and then in the Clean Streams Act that dictates what the fines can be for the charges. And so especially with the Jaeger site, we went with the statutory maximum for some of those counts, less so with Brownlee, but ultimately that's where that comes from. The amount that's laid out within our statutes is very minor. Now, having said that, I will say that the positive effect that comes from our agency getting involved and filing criminal charges is that it has not been done in Pennsylvania. DEP will come along and levy civil penalties against these operators, but it is a whole different ballgame to be charged criminally as an entity that's operating in Pennsylvania. There's a lot of secondary fallouts that come from that. And I will tell you that it has an impact in and of itself that is separate from the money that the company has to pay. I will agree that that part of it is minimal. And, we're stuck with the statutes that we have. But I think there's a genuine incentive for companies not to get charged criminally, and that comes to play in what we do. And I'll also say that in addition to the fines that are imposed, we also sought out restitution in terms of a charitable contribution that the company had to make that would go to the area where the impacts were felt. And so that's separate from the criminal fines.
Okay, thank you. For Dr. Dickinson, can you tell the group a little about the language that has been added to Colorado's oil and gas rules that pertain to the siting of wells and environmental justice?
Yeah, so I think I covered that earlier. So the primary places where this shows up is in defining which communities are disproportionately impacted, or defining disproportionately impacted communities. And I guess just one more point on that. Another conversation I've been a part of is that Colorado is creating this definition for the purposes of oil and gas regulation. We have other legislation around air and water quality violations and fines that is also going to be defining disproportionately impacted communities. And then we have other legislation around climate greenhouse gas mitigations. And so there are various different pieces of legislation. And one thing that I've been discussing with a group of academics and policy advocates is creating a more comprehensive framework for Colorado so that each piece of legislation that's trying to address environmental justice isn't having to build their own, environmental justice definition or disproportionately impacted community definition. So I think that's, and as I said earlier, I think, there's more work on that. There's been more movement on defining which communities are disproportionately impacted than specifically saying how to engage those communities meaningfully.
Okay.